Shannon Brownlee just heard that they're releasing all the children's Tamiflu so that kids can get this with over 100 children who have died this year, they believe, of swine flu. What about the effectiveness of Tamiflu?
Well, let's talk about that in a second, but let's go back to this issue of 100 children have died this year. The death of any child is a tragedy. I can't imagine losing my own child. But 114 children have died this year, and last year, during seasonal flu season, 115 children died. So we are certainly seeing deaths in children, and we are certainly seeing more deaths during swine flu among younger people compared to what we usually see in seasonal flu, which is deaths among the elderly. But that doesn't necessarily mean that lots and lots and lots of children are dying compared to a seasonal flu year. So it's important to keep that in perspective. As for Tamiflu, Tamiflu and Lenzer are the two antiviral drugs that still work against this kind of flu, this kind of virus, and they don't work very well. On average, they will help a basically healthy child or healthy adult reduce the length of their flu symptoms by about a day. If you take it before you're exposed to the flu, there's some evidence that it may prevent you from getting the flu. So these are not terribly effective drugs, and we've spent billions and billions of dollars in stockpiling these drugs.
The Tamiflu, talk about a name from the past, the former Defense Secretary Don Rumsfeld, who you mentioned in your Atlantic piece.
Yes. The way we began building up our stockpile of Tamiflu began shortly after 9/11, when there was worry that we might be vulnerable to some sort of a biological attack. And so the Bush administration and the Congress authorized the stockpiling of Tamiflu and Lenzer, these two antiviral drugs, not only for the civilian population but also for the military. And at that time, Donald Rumsfeld was the Secretary of Defense. He was also the former chairman of the board of one of the companies that manufactured Tamiflu. Manufactured or held the patent, I can't remember exactly which. And the decision was made under his watch, and it's not clear whether or not he was involved in this decision, but he stood to gain financially, personally, from the stock that he held in this company.
How investigated has this been, his conflict of interest here?
It was investigated at the time. A couple of places, other magazines looked at it. I believe Fortune or Forbes looked at it. I can't remember which. And it was looked at, and so it was yet another event that was reported, and then everybody's moved on.
How dangerous is it to go to the emergency room, Shannon Brownlee?
This is exactly where you shouldn't go if you aren't really sick. If you really want to get the flu, go to the emergency room. And one of the worries, and one of the things that's actually happening, is that people who are not really sick are flooding into emergency rooms. And one of the things that they're looking for is the drugs. They're looking for Tamiflu. And one of the things that is happening is that when you crowd emergency rooms with people who aren't all that sick and don't really need to be hospitalized, it means that people who really do need help are not going to get their help. There's very good evidence that people die when emergency rooms are crowded.
We're talking to Jeanne Brownlee, who is an award-winning medical journalist. She's Senior Research Fellow at the New America Foundation. Her latest piece in the Atlantic magazine is called Does the Vaccine Matter? Her book is called Overtreated, Why Too Much Medicine is Making Us Sicker and Poorer. The question of how prepared is the United States to deal with a pandemic. The issue, whether this season's swine flu turns out to be deadly or mild, most experts agree that it's only a matter of time before we're hit by a truly devastating flu pandemic, one that might kill more people worldwide than have died of the plague and AIDS combined. In the U.S., the main lines of defense are pharmaceutical, vaccines and antiviral drugs to limit the spread of flu and prevent people from dying from it. Talk about what you see as what could be a global pandemic.
If we had, this swine flu does not look to be that pandemic because it is a relatively mild flu. In fact, the CDC suspects that many people are actually being infected with swine flu and don't even know it. They are asymptomatic. So this is not that really bad flu that people are very worried about. If and when that flu does hit, there are many questions. One is, could we produce enough vaccine to really stop transmission, to really halt transmission or slow it down? Number two, who should you vaccinate first in order to reduce that transmission? Who's going to be most vulnerable to dying from that flu, and how can you halt the transmission? There's some thinking that if you vaccinate healthy people first and they mount a really good immune response, in effect you keep them from passing the flu on to other people. So one group of people that we probably really should be vaccinating in seasonal flu or in a pandemic is hospital workers and nursing home workers. And what's interesting is that only about half of them get vaccinated in any year. Why aren't they getting vaccinated? Some of them don't think the vaccine works. It's kind of a pain in the neck. Sometimes the vaccine itself causes a few little symptoms. So there are any number of reasons why people are not getting vaccinated who ought to be, who could protect the people who are the most vulnerable. We may need to change our campaigns. We may need to really push vaccine on those people. And so these are the kinds of questions that we have to answer. And then there are the non-pharmacological methods of trying to stop transmission, basic public health. In this pandemic, we are not closing schools. We're not closing public meeting places. There's not that much disruption of regular sort of commerce and existence. But in the event of a real pandemic, we would have to resort to many, many different kinds of measures.
Shannon Brownlee, I want to thank you for being with us, award-winning medical journalist, senior research fellow, New America Foundation. Her latest piece appears in the Atlantic Monthly. It's called Does the Vaccine Matter? Her book, Overtreated, Why Too Much Medicine is Making Us Sicker and Poorer. This is Democracy Now!, democracynow.org, the War and Peace Report. When we come back, our